Hi. If you don't already know me, I'm Amber, the Safety and Training Officer for the city. I wanted to send out a message to employees today because I have something that I really want to talk about. I know you all know about COVID-19 and about how to avoid transmission. The reason that I'm sending this video out today is that the degree of hazard to employees right now is quite a bit higher than it has been in the previous 7 months of this pandemic. I think if you know me, or you've ever been to any of my trainings, you know that I'm never out to scare anyone. That is not my thing. Some safety people think that works, but I think it's really not emotionally good for people, and especially right now, people don't need one more emotional stressor. My whole purpose is to help people get smarter about risks and behave accordingly. I want people to wear their hard hats to protect their heads and their lives, not because their boss is going to write them up if they don't. Verifiable information is my teaching tool of choice. That being said, I wanted to give you some of this verifiable information in order to illustrate to you how the degree of risk in our area, as well as in our work groups, has increased over the past month, and how we really need to respond to it in order to reduce the risk to everybody, both the people we work with every day and the folks we're connected to at home, our friends, relatives, loved ones, etc. So, the first piece of information I have for you is that over the weekend, Minnesota hit 2 record days of new cases of COVID-19, both exceeding 3,000 new cases in a single day. That's a lot of new cases for a state in a single day. Second, the stat that I really pay attention to is the number of active cases, because you could have a boatload of cumulative cases but 0 active cases, and that would be, for all intents and purposes, a really good thing. Unfortunately, the number of active cases in Minnesota has more than doubled over the past month, from a little over 8,100 to over 18,000 in just 1 month of active cases. The third piece of information I have for you is that the number of active cases in St. Louis County has gone up by more than 50% over the past month, and Douglas County's active case numbers have more than doubled during the same time period. Fourth is the number of positive cases in city employee work groups within the month of October was 14, which is twice the number of the cases we had from March through September combined. Lastly, fatality rates have trended downwards since testing has become more available, which is good, but there are groups of people who are much more susceptible to COVID-19 than your average 20 to 30 something employee. Not that most of you are 20 to 30, just using that as an example. The CDC states as of today, November 2nd, that fatality rates for this infection are 90 times higher for people ages 65 through 74 than they are for people in their 20s. That's my mom's age. For people 75 to 84, that's my dad's age, their fatality rates are 220 times higher than folks in their 20s. For our beloved people who are 85 and over, their fatality rate from COVID-19 is 630 times higher than for people in their 20s. In fact, in Minnesota, the fatality rate of our grandmas and grandpas over the age of 84 is more than 1 in 4. 1 in 4 in this age range who get COVID die from it. Now that I have all those stats out of the way, I want to talk about how we work together. I do assessments on all types of hazards, from fall hazards to crush hazards to chemical hazards. I seem to see that, you can make nearly every job safe if you identify the hazards and kind of find a way to eliminate or mitigate them. Same with infectious disease. If you eliminate the transmission pathways, you eliminate the risk. So our biggest risk in working with each other right now in regards to transmission is when we get close to each other. If you're sharing a breathing zone with someone else, you may inhale their exhaled moisture particles. If you stay 6 feet apart or more, your breathing zones really don't overlap. So that risk is mitigated. So they can overlap a bit, which is why we also encourage masks. We mandate masks in some cases. Even if you're in common indoor spaces with others like break rooms, hallways, bathrooms, by the copy machine, etc. Even if you're 6 feet apart, you should be wearing a mask as well. That it helps to reduce the spread of moisture particles and mitigates that risk of potential transmission to your coworkers. By the way, always feel free to contact either myself or Steve down at Public Works for extra masks. We have a bunch. Fomite transmission, which is, touching the same stuff as other people touch, common touch surfaces like doorknobs and copy machines, etc. It still poses a bit of a risk, which is why we should wash our hands often, so germs aren't hitching a ride on our hands, and then we touch our eyes, nose, and mouth and infect ourselves. Touching our eyes, nose, and mouth with germs on our hands just grants those germs full access into our mucous membranes, which is a common route of transmission for most easily communicable diseases like cold and flus and stuff like that, but also COVID-19. I know you all know those prevention measures. Keep 6 feet apart, with or without masks. Wash your hands frequently. Don't touch your eyes, nose, or mouth without washing or sanitizing your hands before and after. You know all this stuff. I just want to make it clear to you that now is absolutely the wrong time to get lazy about it. It is the wrong time to take outside social risks like having your annual knitting party or doing your annual lutefisk feed, or even just having friends over friends over casually if they aren't distanced and outdoors, or wearing a mask and distanced indoors. Now is not the time for extra risks. Now is not the time to get lazy about these prevention measures, and the reason is because there are more cases in our city, in our state, and in our work groups. If you do happen to feel like you're getting sick, contact your supervisor and go get tested. You can do the saliva test down at the deck Wednesday through Sunday, and results are usually coming back within a day and a half. If you have kids that need testing, I highly recommend the saliva tests over the traditional nasal swab. You can get your test through Essentia too, up at the old Sears in the mall. That's fine. There's even rapid testing over at MedExpress and Cloquet, which has a 15-minute turnaround time for results, but they may be tough to book. They're kind of busy. If you have close contact with someone who tests positive for COVID, you have to quarantine for 14 days from your last day of contact. Now, let me define that for you. Close contact is not being in the same room as someone. It is not being in the same grocery store or Menards as someone. It is being within 6 feet of someone with or without masks for 15 minutes or more. It may also be if you cared for someone with COVID, or you touched or hugged them, you got respiratory droplets on you, somehow they sneezed on you or coughed on you, or you shared eating utensils with them. So close contact is close, which is why you should always be distanced from each other at work whenever possible. That way, if one person gets COVID, we don't have 9 other people who have to go on precautionary quarantine because they were all working in close quarters together. Now back to quarantine protocol. If you had close contact with someone, close contact as defined before, 6 feet away for 15 minutes or more. If you had close contact with someone who tested positive for COVID, you can certainly get tested during that quarantine time if you want, but a lot of times you're not going to show symptoms yet. And if you're not showing symptoms, you'll probably test negative, even if you've been infected. The virus, as far as we know not a ton about it yet, but we know some things. The virus, as far as we know, has about a 2 to 12-day incubation period, depending on the person. So if you get tested on day 3 or 5, you'll probably be negative. You may not even test positive till day 12 if you got infected. As far as we know, in typical symptomatic cases, people really start to be infectious to others about 48 hours before they start showing symptoms. All right, back to the distancing and masks topic. I recognize that it is sometimes annoying to do the things that mitigate transmission, but it's the right thing right now. We've got methods to reduce the risk of spread in the workplace, and when we stack them on top of each other, they multiply in effectiveness. You can stack masks on top of distancing, on top of frequent hand washing, on top of don't touch your face, and the risk decreases with every precaution. They stack. And if people do all of these things well and consistently, cases will decrease because transmission routes will be eliminated. Though I do want to mention that the majority of our COVID cases here at the city originated not from workplace spread, but from outside social contacts. So please make a renewed effort to reduce the risk to yourself and others at work. Stagger your breaks if that helps. Distance yourself. Wear your masks because it protects your coworkers and you and all of your beloved people, not because your boss will write you up for not wearing it, though they certainly can do that. Take separate vehicles. Distance yourself in ways that work for you. Please don't work close to people if you don't have to. We have hundreds of hardworking employees, and all of them have a Venn diagram, you know, those ones with overlapping circles of who they interact with at work, at home, at leisure, etc. And we not only need to protect our employees and our coworkers, but we also need to work to protect their Venn diagram of beloved people. I'm a big fan of people. I like people, especially the people I know. I want you all to last as long as possible, and I want your beloved people to do the same. So thank you for doing your part to help reduce the risk of your friends and coworkers here at the city. I truly appreciate your efforts, especially now that risks are increasing in our area. Thank you for watching out for each other. If you have any questions on COVID protocol, info can be found on the city website, both on the homepage and in the HR section. You can also always email, call, or text me for additional information as well. If you have a really urgent concern or situation, you can call me after hours if you need to. My number is 218-349-8141. Thanks for listening, and have a safe day.